Welcome. My name is Dr. Amy Ross. I'm a double board certified dermatologist and the founder of PH Dermatology. We'd like to welcome you to our skin lifting and tightening virtual event featuring the new Sofwave technology. Please be sure to stay until the end of the presentation for a live Q&A. You'll be able to submit all of your questions via the questions tab and have them answered live. One attendee will have the opportunity to win a free neck treatment, and all of the treatments booked after our event will receive 15% off. Sofwave is a non-invasive skin treatment that uses advanced ultrasound technology to stimulate collagen production and improve skin's firmness and texture. It's FDA cleared for reducing fine lines and wrinkles, among other things, on the face and neck, and it works by targeting the mid-dermis layer of the skin. That's where collagen lives, without damaging the surface. This is a treatment that has no downtime. There's so many devices and treatments out there, but we decided to bring this to PhD because it works. It's a very highly requested treatment that we get. Is how do I improve the skin around the neck and the lower face? And this is the one device that we found that works, has FDA approval, and no downtime, which is really what our patients are demanding right now. We're very excited about that technology. 90% of the patients that have this treatment would do it again. And that, my friends, tells us this is a great treatment. Sofwave sets itself apart from other skin tightening and wrinkle reduction treatments because of its unique ultrasound technology. Unlike lasers or radio frequency devices that you may have heard of, those can affect deeper layers but require more downtime. Sofwave targets just the mid-dermis. Again, this is just where the collagen forms, without harming the skin surface. This means patients get impressive results with minimal discomfort and virtually no downtime. Virtually no downtime. So important. You can go right back to your day because Sofwave uses a uniform ultrasound beam. It's very precise and consistent than older technologies. Most patients only need one treatment. It's about 30 to 45-minute session to see visible improvement with continued collagen rebuilding over time. Sofwave is designed to treat some of the most common signs of aging, specifically fine lines and wrinkles and mild to moderate skin laxity. It has 9 FDA clearances. 9. It's very impressive. Lifting the submental, the area under the chin, improve fine lines and wrinkles, lifting the eyebrow, treating acne scars, lifting the neck, improving skin laxity on the upper arms. He's excited about that. Improving the appearance of cellulite for the short term. It stimulates your body's natural collagen production, and it goes beyond collagen production, improving both elastin and hyaluronic acid production. What's exciting is that it does all of these things without needles, surgery, or significant downtime. Sofwave is ideal for anyone noticing early signs of aging or looking for a natural refresh without changing their facial expressions or features. One treatment can help restore a more youthful, refreshed appearance gently and effectively. A good candidate for Sofwave is typically someone in their 30s to 60s who's starting to notice signs of aging, like fine lines, wrinkles, or mild to moderate skin laxity, especially around the brows, the jawline, and neck. It's ideal for people who want a noticeable lift and firmer skin without surgery, needles, or downtime. Because Sofwave uses non-invasive ultrasound, it's safe for all skin types and all skin tones, whether you're looking for an early prevention or a refresh without changing your natural look. This is a natural treatment. Sofwave is a great option. It's also perfect for those with busy lifestyles. Nobody has time for downtime. Most people go right back to their normal routine after the treatment. One of the best things about Sofwave is that there's little or no downtime. You can return to your normal activities right after treatment, even wear makeup the same day. Some people may have mild redness or swelling, but it typically resolves within a few hours. Most patients start to see improvements within 4 to 6 weeks, with maximum results appearing around 3 months as new collagen continues to build. It's a gradual, natural looking transformation. No one will know you had something done, but they will notice that you look refreshed. Hi, we're going to walk through a consultation with an actual patient and point out all the areas that could be used with the Sofwave device. So first of all, she's in her late 40s and is really not interested in any type of surgical or invasive treatment. So definitely not interested in a facelift, not interested in anything with needles, so no tox, no filler. She's just really looking for a natural way, non-invasive way to refresh her appearance. Great candidate, perfect candidate for discussions around all the ways that we can use the Sofwave technology. So again, ultrasound technology, non-invasive, no downtime. Busy person doesn't have time for a lot of things, nor desire. So I think that's really important as we have a consult, always figuring out what is the goal of the treatment for each individual patient. So for her, Sofwave will just kind of start top to bottom. The Sofwave is FDA approved to treat, starting at the top, areas eyebrow lift. So we can use the device to give her a little bit of an eyebrow lift. It's also FDA approved to treat the jawline. So jawline here is another area in her of particular interest. This submental area, improved tightening and laxity in the submental area, and then the neck in general. So we can treat the entire neck with a Sofwave. And all this does is gives a little bit of lifting and tightening of the skin. She also has some scarring, a little bit leftover acne scarring, and then scarring from other procedures. And the Sofwave ultrasound technology is FDA approved to treat acne scarring, as well as fine lines, wrinkles, and laxity. So focusing on her face, those are all the areas that we could use the device, and we would notice significant improvements with her. With, again, one treatment is typically the most commonly needed treatment. 30 to 45 minutes per session, no downtime. Occasionally, if patients have an area where there's needed a little bit more significant improvement, a second treatment could be in order. But again, most treatments are, most areas are treated with one session. So in her, definitely the eyebrow would be a one treatment session. I think we may consider one treatment with the neck area, see you back in 3 months, reevaluate, just decide if we had the outcome that we desired, and potentially a second treatment. But never more than that. And certainly this collagen production occurs over 3 months. So assessing anything in advance of that is really, that's our ideal timeline. So we hope that was good information, and we look forward to helping you achieve natural, refreshed beauty. Thank you all for attending our virtual event. We hope this was a great use of your time. Please check your text after the event, and we're going to reply back to book a consultation, and we'll contact you to schedule. You're invited to stay around for the next 15 to 20 minutes and chat in the question box. This is a live Q&A session. One lucky person will win a free neck treatment, and all participants who book after this event will receive 15% off. Thank you again for your time, and we look forward to helping you achieve natural beauty. Hey, how are you? Hope everyone can hear me. My name is Dr. Amy Ross. I'm excited to be here tonight and follow up the video. I hope you learned a lot from that, and we can learn a little bit more. So live Q&A, please feel free to ask any questions. I'll do my best to answer anything. And if not, I can follow up with you after, but I'm super excited to bring this technology to our office, and really am here to answer any questions that you have. So I'm going to just start to scroll through some of the questions that have come through on the question box first. And it looks to me like how do the results last? How long do the results last? And I think that's a great question. And you may not like my answer because it's going to be, it varies. This is a one-time treatment. So it takes about 3 months to build collagen. So whatever method that we use to build collagen, so whether I tell you to use tretinoin, a topical retinoid to build collagen, or you have a Sofwave technology treatment to build collagen, takes about 3 months to build collagen. So whether that's a laser device or an ultrasound device, takes about 3 months to build collagen. And then how long that lasts depends a lot on how old are you and what are you going to do to maintain that. So if you're really great about skin routine, and so you're using a retinol every night and you're using sunscreen every morning, that treatment is going to last much longer than if you're somebody who, you know, we all live life and want to go out in the sun. And I'm in Florida, so we're definitely exposed to the free radicals, but if you protect your skin, it'll last much longer. So I know that's not the best answer, but it depends a little bit on how much you are aging. And certainly I'm in my 50s, so aging for me happens faster than if I did this procedure on somebody in their 40s, just because of hormones and things like that. So so I guess the answer is, you know, it varies a lot depending on how much you take care of your skin. But it is certainly a one-time treatment. So, and then for a lot of laser devices that we use, sometimes I say, look, you'll do it 1 or 2 times the first time you have the procedure, and then maybe every year or every 2 years or every 3 years, you'll come in and you'll get one-time maintenance. So that is kind of how I think about Sofwave, and that's the experience that we've had with it thus far, but it, you know, pretty new to the device, and have had great results, but still pretty new to that. So hope that was helpful answer to that question. What happens if you need a second treatment? So I think we mentioned that most people, and depending on the area, will have one treatment and be done. But there are some, you know, people who are a little bit older, and I would probably say people maybe who are in their 60s. And depending on the location, you may need to have a second treatment. And you would wait 3 months, and then we'd evaluate you together and try to figure out whether that was something that you wanted to achieve. It's not that you wouldn't achieve any results with your first treatment, but a second treatment if you were really trying to improve further laxity. And that's, you know, depending on what you were hoping to achieve. Is there an age that is too old? Okay. I know in the video we pre-recorded and said 30 to 60 is kind of the sweet spot on age, and I think that's correct. Someone asked a question about, is it too old? If you're in your 70s, is it too old? It depends. You'll probably hear that a lot tonight. It depends. So happy to see you in consult. But a 70-year-old who is active and has been taking care of their skin and their whole life could very much look like a 50-year-old who has been out in the sun and lived in Florida and maybe hasn't done the best job taking care of their skin. So it is a little bit dependent on what the condition of your skin is. If there is no laxity in your skin and very, you know, this is not a facelift. I do want to say that. So I don't think there's an age where it's inappropriate. Every skin is different depending on how you've maintained your skin over time. But I think that there isn't, it's very individualized and treatment can be done. So super excited about and happy to speak to anyone, and consults I think are important before you do this, just so you know what to expect. Does it work on the minor forehead wrinkles or the décolleté area? And so yes is the answer. So forehead area is typically an area. So up here, we really do have relied on toxin to treat that area. It works well, but I do appreciate that some people don't want to have toxin treatment. And I think that's a beauty of this procedure, is it is natural. There's no needles. Natural is not the right word, but there's no needles, right? And so I think people right now are looking for non-invasive ways to do things. And so this is an alternative for that. So we can use it on the forehead. We can use it on the upper brow. I happen to sometimes use tox on my upper brow to get a lift, but this is an alternative to that if you don't want to do tox for your upper brow lift. And décolleté for sure. I think this area, which I haven't treated yet, and I'm super excited to do that when I get there. This is a great area. Down on your chest, yes, if you have wrinkles. A lot of times people's chest and décolleté area, truly décolleté, like down on your chest,
is often a laser procedure because you don't get a ton of wrinkles. But if you have wrinkles on your chest, certainly you could do it. I think the perfect combination for a neck treatment is what we've been really excited about, and what we're doing is doing Sofwave ultrasound for improvement of the fine lines and wrinkles, and then using a fractionated laser to do pigment and surface. And it is really probably the best thing that you can do to improve the neck area of your skin. So pretty excited about that as well. Questions about cost. So the neck, it depends on the area. So between $1,000 and $1,500 is typically the cost for face, neck. I believe the arms are $1,500 as well. So that's a ballpark of the cost is between $1,000 and $1,500. For tonight, every procedure that anybody who attends this event is 15% off the procedure cost. So 15% off on anything tonight, and the typical cost range is $1,000 to $1,500 for each area. All right, let's see some other questions. Can this be used under the eyes? So FDA approval for this is brow, because you're trying to lift, right? So under the eye, and I'm gonna make assumptions on the question because there's not more details, but under eye aging is not usually, it can be a collagen issue, but a lot of times dark circles are because of hollowing. So that's loss of the fat pad under the eyes. So that requires a little bit more than what this device would do. Under eye aging is also oftentimes caused by vascularity, so blood vessels. So I think that it has not been used. Doesn't mean it couldn't be. I certainly think maybe that's an option. And as technologies are out there, typically the development of off-label uses happens, but it is not FDA approved to treat the under eye area. Let's look for some other questions. Do results continue to build after the 3-month mark or max out? So 3 months is pretty much what it takes to build collagen. I think that's going to be where you get your peak results and pretty much max out. So that's really when we get you back in the office. We work together and decide whether you're happy with the results. If there's something else that would improve your appearance. So again, a lot of times we're complementing this with a laser procedure if it's working on surface changes of the skin. Because remember, this is working in the dermis. So we're building collagen, elastin, hyaluronic acid, but we're not doing anything to the epidermis. So the epidermis is really where we are responsible for the glow of your skin. And this is working in the dermis. So after the 3-month mark, you are really going to see your most results at then. And at that point, you can say, okay, look, great on the dermis. We built some collagen. Let's see if we want to improve the surface and complement it with maybe chemical peel or another laser procedure. So 3 months is pretty much the maximum effect of this device. Okay, so is it painful? Not gonna lie, this procedure, I've had a lot. So we have many devices in our practice. So we have multiple fractionated lasers, we have thermage, we have microneedling, we have a lot. And I've probably had tiny bits of every little thing because I oftentimes am like the demo person, although I don't think I've had one full treatment of anything. I will say that because I never have time. But so I have had this procedure done. It did under my chin, so submental area, and that was fine. Totally. We do recommend topical numbing. You don't have to have it. I did it in an area where I didn't have topical numbing. Because topical numbing really works on the surface. And so we were testing the theory that, okay, well, if it's just surface, if we're working in the dermis and this is just the surface, the topical numbing shouldn't help. But I do want to tell you, I think the topical numbing does help. So we do recommend topical numbing. We have in our office what's called the Zimmer, which I say is kind of like a air conditioning kind of condenser that blows cold air. And we use it to distract probably more than anything else. So the Zimmer device is used, and that with those two things, it really is not bad. The pulse itself lasts. Each individual pulse on the skin, it lasts about 5 seconds, and we can lengthen it a little bit or shorten it a little bit, but ballpark is 5 seconds. And usually say I can do anything for 5 seconds. So, so really is not bad. I think with the combination, I would highly recommend that you would do the topical numbing. It is an extra half an hour added on the procedure because we put the topical numbing on your face and you have to kind of sit around. But I would suggest that you do that because I think why put yourself through any bit uncomfortable and just come in and plan to have it done. And then, by the way, you can do whatever you want because there is absolutely no time, so no downtime. So once you have the procedure done, go out to lunch, do whatever you want. It is, you can put sunscreen or makeup on right away and head right out and no one will know that you had anything done. So recommend for sure that the procedure is done with topical numbing, and then we have the Zimmer, and it is not, it is much more comfortable than Thermage. And somebody asked a question, how does this feel? Thermage, if anyone has had it, can be very painful. And in the practice that we have it, we have had, there are times patients have requested what is called Pronoc, which is it's kind of laughing gas if you've ever used that. We do not need that for this device. So Thermage, yes, this, no, it's much more comfortable than Thermage. Here's a question about comparison to IPL. So IPL is intense pulse light. So intense pulse light, it's not a laser. Oftentimes it's considered comparable to a laser, but it's actually not even as effective as a laser. IPL treatments are really targeted towards pigment. So brown spots in your skin or broken blood vessels in your skin, IPL works on treating those, but it's a very, very superficial treatment. So IPL would be a wonderful treatment to combine with Sofwave. So Sofwave targets the dermis. So it's really going to build collagen, build elastin, increase, tighten. And then you could do IPL after. And that would get rid of the brown spots, get rid of the red spots if that's what the problem is on your skin. But it is very, very different. It's targeting a much different area than the Sofwave device. Does this help with crepey skin on the neck? 100%. That is what this is. I mean, it's the beauty of this machine, and I think it's the first thing that we really have that can treat a neck area. There's a very, very well-known cosmetic dermatologist that, again, I'm in my 50s, mid-50s, and probably 10, 15 years ago, and we were sitting around talking, she's like, I give up. She's like, I just wear scarves now, and she's about 20 years older than I am. I think we're finally have something where that is not the case, and I'm excited to finally get my neck treated, but haven't done it yet. But I do think this is the first thing that really has received FDA approval and does help with crepey skin on the neck. The neck area is really hot right now, so there's actually a couple things that you can use in combination with Sofwave. This is the only one that really has shown improvement. So Sofwave targets the dermis, so great alternative for neck skin. Combine it with some fractionated laser or IPL to improve the epidermis or the top. And then if you are not toxiverse, Tox just got approved, FDA approved to treat what are called the platysmal bands, which are the muscles in your neck. And those three things are really all very effective in improving and rejuvenating the skin on your neck and the appearance of your neck. Remember, cost again, so $1,000 to $1,500, and anybody who is attending the event tonight, 15% off any treatment. So I think that's a great, and then we will have one person who receives a free neck treatment. So that is, it's a great thing for anybody who showed up tonight. So thank you for being here. After tonight's event, again, you'll get a text message. So people are asking, how do you get that? So you'll get a text message that says, from the event, reply with the word LIFT, L-I-F-T, and then you'll be contacted for a consultation. And that will help facilitate you getting the discount off the treatment. What does the treatment feel like? So I described a little bit. It feels like a little tiny, like electrical, I don't know, just a buzzing. Last again about 5 seconds, so we can shorten that a little bit and it's a little bit more intense, or we can lengthen a little bit to spread out that pulse. So if you feel uncomfortable, so there are ways to change the treatment. What we do is we do what's called treat to total energy. So we are adding energy to the skin in order to improve the dermis. So no matter whether we space that energy out and it takes a little bit long and a little bit more pulses, we will still deliver the same amount of energy. If you are, if your pain tolerance or your discomfort tolerance is a little bit higher and you want to get that done really quickly, we can deliver that energy over a shorter period of time. But if you want to not in any hurry and you're interested in just kind of being having that energy delivered over a longer period of time, we can space that out, and then it will be a little more comfortable. So there are ways to adjust that based on how you think it feels. But to answer your question, it feels like a little buzz, like a little electrical buzz. The treatment is available in our office on Howard Avenue in South Tampa. So if anybody has ever been to Burns Steakhouse, I don't know if I'm allowed to say that, but we are a couple blocks down the road from Burns, and that is the office that we have this procedure. So it's pretty convenient for anybody. I feel like everybody drives in for that location. So the arm, okay, so how long does the procedure take? The procedure doesn't take a lot of time. So I talked about topical numbing. So topical numbing, it usually takes about 30 minutes. And then the procedure, depending on the area, takes about less than 30 minutes. So definitely pretty efficient. Each pulse and then a grid. So the grid is about 2 inches on an area. Each pulse is about 16 pulses. Each pulse is about 5 seconds. So it's really not very long. But by the time we get you laid back and the topical numbing worn off and whatever, it can, about 30 minutes is about how long the treatment takes. Upper arms we talked about, so yes, and it's not, I want to clarify this, so, and I'm sorry I have a long sleeve shirt on. So their upper arms, the crepey texture on your upper arms, so it's really more this anterior area where it helps that crepey texture. It does not, and I want to be honest and realistic, when people have the really like saggy skin on your arms, it's not going to remove that or get rid of that. It does do the crepiness of the skin, but not the sagginess of, so when people kind of lift and they have that lift under there, it's not going to remove that. So I want to make sure managing expectations is really important. This is, certainly a non-invasive device and has limits to what it can do. So not going to completely remodel your arms, but does get rid of that crepey texture. All right. Reminder, so after tonight, which we're getting close on the end of this one, it's almost 7 o'clock. Time goes by really fast. You're going to get a text message. So reply with the word LIFT, L-I-F-T, to be contacted for a consultation. So don't forget that as we get near to the end of this. Here's a question about immunocompromised patients. So immunocompromised patient, I think probably depends. There's not, if you had a collagen disorder, and there are some things like scleroderma, which is I would not recommend something like this. So I don't know for sure what the condition is that this person is asking me about. Certainly there are some things where this would be contraindicated, but generally speaking, I would not say we cannot do this on anyone who's immunocompromised. I think it's very case dependent. So happy to answer that question in more detail in a consultation with someone's full medical history. It is a medical procedure. I don't want to diminish what it is. We are a medical dermatology office that offers cosmetic services. So I think that that's the best environment to receive things like this in case there are any issues and a full medical history appropriate. But not one answer to some of these questions. Okay, so thighs. So I think this has temporary, and everything else that I talked about. So the neck, the submental, the chin, eyebrow lift, all of that, the building of the collagen, the arms, that is all treatments that last 3 months, and as I discussed before, depending on how you maintain it, maybe you do it again, or maybe you do it every couple of years, but that is a one-time treatment and doesn't go away, right? You build collagen and it stays there. It stays there until until you age and the collagen naturally diminishes, but it isn't temporary. This does improve cellulite. Sorry, I'm getting back to the thigh point. It does improve the temporary appearance of cellulite. So it doesn't work the same as building collagen. So cellulite is formed because the fibers in the septae in the fat are more noticeable. So building collagen in the thighs temporarily reduces the appearance of the cellulite, but it doesn't get rid of it. And I think that's an important distinction. I don't want to promise and tell you this is going to get rid of your cellulite. It will improve the appearance of it, but it will not obviously remove it, or it will not remove it completely. Sorry, there's a lot of questions here. I'm getting there. Let's see. Consultations in our office, I believe, are $125 something. Don't quote me exactly. Between $100 and $150 for a consult, and go through. Not, you know, I think a fair consult includes Sofwave, but also includes what else do you think would be. What are your goals? So Sofwave is amazing and great, but it may not be the thing. So coming in and letting us do a consultation and say, okay, just like somebody said, is this like IPL, right? Well, if your neck is your area that you're interested in, let's talk about how we can improve it. And Sofwave will build collagen, and IPL can help with the pigment. And if you're looking to have a brow lift, I think it's fair to say, okay, Sofwave will help with that, but if you might want to add a little tox if you don't want to do that. So there are lots of what was beautiful about Sofwave and why a consultation is really encouraged, because we have a lot of tools available to us now that we did not have. I've been in practice for 20 years, and you know, things are very different now than they were before. I started the practice in the days when we used Cosmoderm and Cosmoplast, where you had to have a patch test on your skin to make sure you weren't going to have a reaction to it. So we have evolved tremendously in the past 20 years. And I think that having a consult to know all of the things that are available to you, both invasive and non-invasive, is really important. So the total space on the face done at a time. There is no limit. So that's a great question. Typically, I think, 2 areas. So if you're doing obviously both sides of your face, you would that's 2 areas. You can do, neck. We typically do a face, a neck. You could do face and neck together, no problem. Limiting mostly, and I do this with laser procedures as well, the topical numbing medication has lidocaine in it, and lidocaine over a certain surface area, depending on the strength of the lidocaine, is oftentimes a limiting factor. So lidocaine toxicity is a real thing. So please, by the way, as a safety thing, don't go out and buy crazy high strength topical lidocaine compounded in who knows what kind of pharmacy and put it all over your body, because lidocaine toxicity is a real thing. First sign of that, by the way, is a little bit of numbness and tingling around your mouth. So again, making sure that the topical lidocaine in the strengths that we use it in order to be effective can be one of the limiting factors for area. So there's a question about how long do you have to wait after Sofwave having a laser treatment, and I don't know that there's a prescribed answer. They work very differently. The patients that we're seeing, we have them come back in a couple weeks, check on them, and then do the laser procedure. That's just it's just been practical for us. But frankly, I imagine you could probably do it the next day. Medically speaking, they're working in different areas. You do get very, very mild swelling from this procedure. So mild, you'll have a little bit of redness on your skin. And I went straight to, had dinner with friends, and nobody knew that I had anything done. So, but there's a tiny little bit of swelling in the dermis, right? We were focusing on the dermis. You get a little bit of swelling in the dermis. So I think letting that swelling and that where we did the procedure diminish completely before then applying another laser technology to it. I just kind of think it's prudent to do that, but it's not necessarily required. So I would probably say minimum time I would maybe recommend doing would be a week between doing a Sofwave device and laser device. All cellulite, no matter where it's located, would be improved temporarily. So skin laxity, so that crepey texture, that is a, quote unquote permanent or more longer duration procedure based on how well you maintain your skin. But cellulite in and of itself is temporary and could be 6 weeks, could be 3 months improvement, but it's not something that's long lasting like the building of collagen is. I'm going to remind you one more time, you're going to get a text message after the event is over, and you need to reply to that with the word lift and you'll get 15% off your treatment, and you'll be registered to win the free treatment that's giving away. Does the physician administer the treatment? That is totally up to you. So I do the procedure. Again, we do this in the Howard Avenue office in South Tampa. But we also have a PA. Her name is Shayna Linsky. She does this a lot. So I'm happy to have you, have the procedure performed by myself. There are 2 other physicians in the office, Dr. Freya Meyer and Dr. Margaret Rinker, and myself, Dr. Amy Ross. So there are 3 physicians in that location, but the PA in the location, Shayna Linsky, probably does it more than any of us. And she's terrific. So, but yes, you do have the option to have a physician administer the treatment. And there is a physician in the office every single day, no matter what. So, just if that's comforting to you. Any alternative to lidocaine? Yes, for sure. Like you don't actually need to have any topical numbing. So lidocaine I think is good, but I actually did do this without. I'm a little bit wimpy on some of these things. I did it once without the lidocaine and it was fine. I got through it. I'll tell you where it's most uncomfortable is over bony prominences. So when I did my cheeks and I did under my chin, like not a big deal at all. Again, I've not done my neck yet. I can't wait to do it. No problem on this, I say cheeks, but this area, like the where it hurt, where it was more uncomfortable, and yes, I did just say the word hurt, is over a bony prominence. So doing this is a little more uncomfortable. But I did this without any numbing, and I got through it, no problem. So you don't have to use lidocaine, but it is certainly, I would recommend it maybe, just to add in. But if there are people who are sensitive to lidocaine and or don't want to have that feeling because it does feel a little weird, then yes, you do not have to use it. There's no side effects other than a little bit of mild swelling. So again, very minor, like kind of like mild swelling that you wish would stay forever, like that kind of very, very mild swelling. And so no side effects at all. And that lasts literally a couple hours. So no, there's not really any side effects at all. And all right, how we doing? We're getting pretty, let's see, 7:09. I think a lot of these questions are very similar. So thank you for asking the questions. Oh, I missed this one. Vertical lines above the lip. No, and not FDA approved. So this is not FDA approved for the upper vertical lines on the lip. Again, my answer to that is we start to use devices off label as we become more experienced with them. I have not tried it. Doesn't mean I wouldn't try it, but is not FDA approved for that. So I would tell you no on the vertical lines on the upper lip. There's a lot of things we can do for that nowadays, and that's another like laser. So fractionated laser works great on that. If you're needle phobic, then the next 2 things I'm going to tell you won't work, but tiny little bit of tox works in the upper vertical lip lines and filler. And I do not believe in using filler to make people look different than they are, but you can put very, very conservative filler to get rid of the upper lip lines and look very, very natural. But understand some people don't want to do any of that, and in that case, I would use lasers or chemical peels. I mean, there's some amazing chemical peels that can help with upper vertical lip lines. So I don't think you have to go. You don't have to spend $1,500 to get some improvements. So Marionette lines, yes, 100%. So marionette lines are these here. And so anything that's going to lift here is going to improve here. And so absolutely that is something where you will see improvement. So a little bit of lifting here improves this area here. And jowls is, I think, the sweet spot like this. That's probably why this technology was developed, because this area here is the hardest thing to treat. And even if you weren't filler averse, putting filler here is definitely an art in the jowl line and the jawline, because gravity wins. Like we are trying to fight gravity all the time. Placing filler here absolutely can be done, but it is one of the more difficult things. And so an alternative to that, and truly getting rid of some of the laxity and building collagen in the jowls improves that very naturally looking. So absolutely an area to use Sofwave. All right. It's going great. I really appreciate it. I think we went a little bit over time. Remember that you're going to get a text message after this event is over, which I think we're over time. And make sure you reply to it. Hit the word lift. Love to have a consultation, talk to you in the office, and think about Sofwave and how it would work for you, or if it's even the right choice for you. We have lots of options, and this is the one I'm most excited about, probably because it hits my age sweet spot. But there's lots of options available, and we are very much a practice that believes in natural beauty and making yourselves the best version of yourself, not looking like someone else. So please come and reply to the text message, and I look forward to seeing you in the office. Have a great evening, everyone.